you go.
You got it.
All right. FAQs, take one.
So I think an important thing to kind of keep in mind with labial vaginal anatomy is that it's so individualized. You know, again, I always liken, like I said, vaginas and labias to fingerprints. There's no one vagina that looks exactly like somebody else's. And also, at the end of the day, if you have the largest labia in the world and you're comfortable with it, then that's all that matters. You know, we have patients who come in and don't ever mention labiaplasty, but say another woman with something similar would be like, hey, I want to undergo the procedure. So ultimately, you know, it's really just kind of what the patient is looking for. We don't encourage it, you know, and I think that's another important thing that kind of sets us apart too, is like ultimately we're for empowering women, you know, through our clinic. So if you come in and you're like, hey, you know, are there things that you suggest? Are there things that you think I could improve, or, you know, that may make me like sexually feel a little bit more empowered? Then we, you know, do maybe suggest like, oh, these are all the things that we offer if you're interested in any of these. But otherwise, I think in terms of anatomy, that's all going to vary. It'll vary based on your hormones, life experiences, i.e. pregnancy. From a clitoral standpoint, some women have larger clitorises naturally. That can be related to genetics, medical conditions, PCOS, things like that. And then also testosterone use. And we're actually seeing a lot of that lately. Again, I feel like, and you can, again, probably talk about this a little bit more too, but women are, again, empowered. They're getting healthier, they're lifting weight, you know, you're seeing a lot of them in like bodybuilding competitions and fitness competitions. And so a lot of these women are taking testosterone, and we are seeing like clitoral changes and things like that.
Yeah, so the medical term for an enlargement of the clitoris is clitoromegaly, and that can happen, like Kristin said, with testosterone use. There's different types and different ways to take testosterone. We've seen in our experience that some, you know, dosing and, you know, methods of taking it can affect the way the clitoris grows. Some people are just really sensitive to it. And then there's also other medications often that we see with women who are maybe bodybuilding or in competitions that can also cause the clitoris to increase to a size that a person may feel unnatural. And so that leads us to say, is like, okay, well, what can we do about it, right? Because there is a point where when the clitoris enlarges, whether it's due to genetics, medical conditions, or medications, there's not once you stop or once you fix the problem, or it's not going to necessarily go back. So what we can do is we can do surgery to help kind of minimize the look without affecting sexual function. And I think that one of the important things, because that's to understand, is that there's two different parts of the clitoris that we're really looking at when we think about surgical reduction for clitoromegaly. There's the erectile tissue, and there's the non-erectile tissue. The erectile tissue is going to be the part that engorges with stimulation. It's usually not anything that you can see. It's kind of underneath the clitoral hood, kind of goes deeper within the body, almost has like a tubular type of form. And then the clitoral glands, which is the least sensitive, or the non-erectile tissue, is the bulb of the clitoris, like what you can see when you pull the head back. The hood back. So what we do to surgically reduce that is actually remove a portion or all of the clitoral glands, that soft non-erectile tissue. And then while we're doing a hood reduction and a labial reconstruction, and then we lift and tuck the body or the erectile tissue portion of the clitoris in a way that helps to reduce the appearance and overall size. So we're able to achieve the appearance of it without affecting clitoral function, or minimizing the risk of negatively affecting clitoral reduction as much as possible. Well, it's kind of like goes hand in hand, right? So we talked about some of the negative effects of testosterone, which, you know, I feel like are probably more of the exception and not the rule, because
most of the time the
yeah.
negatives you're seeing with higher doses, inappropriate dosing, like that type of thing.
But testosterone can be very helpful for libido, maybe increasing the size of the clitoris just a little bit, you know, which actually helps with stimulation and function, and overall sexual well-being, ability to climax and orgasm. And I think if you are your libido's up and you're more stimulated, then that can increase vaginal secretions, you know, during intercourse. And then obviously hormones. Yeah. You know, if you're menopausal, that can happen.
I think sexual wellness is so multifactorial for women in general. It's not just a physical, you know, there's a mental, there's emotional, there's a lot of it that kind of goes into kind of what turns a woman on. You know, it's not just a hormone that's going to fix the issue. So I think kind of getting to the root of the issue, and every person's going to be different, you know. So is a patient having vaginal pain because they're tight? You know, are they having vaginal pain because they're dry? And you address those issues differently. Sometimes it's pelvic floor physical therapy that helps. Sometimes it's medication. Sometimes the answer is as easy as lubrication.
Yeah.
There are a lot of people for some reason that are just like afraid of lubricant. Sometimes that's all you need, you know? And you know, especially like surgical patients, we always encourage, like, even if you don't normally use lubricant, use it. You know, you may find that just overall it improves, you know, your sexual function. But again, I think ultimately it comes down with women, it is multifactorial. There's not any one answer that can address all of those concerns in like a little tight teeny box, you know, where you're like, it's an all one answer for all concerns. I will kind of underscoring that say, like, use it or lose it. And that's kind of one of the, and I know that it might sound like a little abrasive, but from a vaginal standpoint, the longer you go without intercourse, the naturally tighter your vagina becomes. That's just the way our bodies work. So if you're not having sexual intercourse, the longer you wait to have sexual intercourse, if you're sexually active, now I'm obviously not recommending going
Everybody's
out and being
gonna go home and tell
promiscuous
their
or anything like that. But
partners.
if you're wanting to be sexually active, if you've been sexually active but you're having issues like becoming sexually active again or things like that, you know, again, if there's issues, you want to address those. But, you know, if you're planning on having a long sexual life, you do have to kind of continue being sexually active in order to kind of continue to be sexually active.
Yeah, I think too, it's important to say that, you know, if a woman, especially a younger woman, is having these concerns, seeing a gynecologist first and foremost is probably the most important thing to rule out, you know, that there's anything medically going on, right? And then there's also medications that can affect vaginal dryness, or that can cause vaginal dryness, like certain birth controls, certain other medications that can also affect libido. So all of those, all of those factors need to be taken into consideration. And so I would say the best place to start would be with the gynecologist to talk about it.
But yeah, sexual dysfunction occurs across all age spans. I mean, it happens in young women, all the way into women in their 70s. I mean, we have patients who are in their 80s who are still sexually active. So,
I mean, it's probably just culture, right?
Social.
It's just it's not the norm.
I think there's probably just negative connotations to having like a loose vagina or vaginal laxity, you know? And I think that just goes to a lack of understanding of what causes vaginal laxity and vaginal looseness.
And I think that too, it's just women's health in general is becoming more talked about now than it used to be, you know? I mean, if you think about sexual function for women, you know, we've been talking about sexual function or lack thereof sexual function for men for how long, right? I mean, they came out with a pill, Viagra, you know, and so it's just like the norm to talk about. And so now I think we're finally getting to a space where, women don't just have to feel like, oh, this is just the way it is. It's the same even with other conditions like urinary incontinence. Like, I mean, even our patients now, and as much as, our parents and grandparents, like, oh, well, I just thought this was normal part of life. This is what happens. And so I think that now that we're just shedding light on that there's options for women and gynecological health and sexual well-being, it's just, hopefully becoming more of a topic. Yeah.
I do think ultimately women are still like embarrassed by a lot of, even women our age,
Yeah, and maybe too, it's like,
nobody really wants to talk about, hey, I pee on myself.
Yeah, and it's like, it's even like in movies, right? It's normal to show breast, right? And so it's like, then now we can talk about different size breast and how I want bigger breasts or I don't, and things like that. Yeah, so it's, people just aren't as comfortable talking about vaginas.
Yeah. It's not the mainstream.
Yeah.
What do you think causes queefing?
Well, when air becomes trapped in the vagina and it's only got one direction to release. So I'd say, I guess theoretically, if the vaginal tissues are relaxed or the vaginal anatomy is changed after vaginal deliveries, that could technically, I guess, put you at increased risk of queefing. I think probably, sexual activity. Different types of sexual activity may cause it.
Positions
like that, yeah. I don't think it's abnormal by any means.
Yeah.
It's a very normal thing to happen.
So why would a woman opt for hormone replacement therapy or consider hormone replacement therapy? Usually women who are seeking out hormone replacement therapy, it's because they're symptomatic to something. So a lot of times we're seeing patients who have reduced energy, brain fog, they're lethargic, hot flashes, mood swings, vaginal dryness. I mean, there's just a whole slew of symptoms that kind of come along with hormone replacement. And you can replace testosterone, estrogen, progesterone, and each of those replacements are going to be based on typically like your main symptom for coming in for replacement. Some women just need testosterone, some women need a combination of both, and some women just need estrogen or estrogen and progesterone combined. You would have a discussion with your provider, kind of talk about your symptoms, and along with that, there are multiple methods of hormone replacement. There's pills, patches, creams, injections, pellets, and they're all going to kind of have their own risks, benefits associated with them. But I think ultimately when it comes to hormone replacement, you do want to, one, do all of your proper screening. So from a female standpoint, you want to make sure you're up to date with PAPs, you keep your mammograms up to date, and that you have somebody who's screening those for you regularly. Doing regular well woman kind of breast exams yourself, kind of monitoring that on your own outside of your routine screening. And then just knowing that anytime you are on hormone replacement therapy, you are at increased risk for heart attack, stroke, blood clots, potential cancer risk associated with or increased rate of growth of cancer. And all of these risks should be minimized when you're appropriately dosed and you've gone through kind of the proper channels of screening and all of that, which we would do with your provider.